Thank you to Administrator Johnson for being with us today. As has been highlighted throughout this important hearing, we're at a key point for supporting community health centers. In New Hampshire, community health centers serve as a critical site of care, filling gaps in rural areas and ensuring people of all backgrounds can access the health care that they need. Cost-effective preventative care is under attack by conservative courts across the country trying to politicize our healthcare system, and it's essential we defend the healthcare providers who are delivering life-saving services. The National Association of Community Health Centers finds that overall, community health centers save the healthcare system $24 billion annually by increasing access to comprehensive, high-quality preventative and primary care. If Congress does not invest in our community health centers, American health will suffer and the cost of care will increase. I applaud my colleagues for introducing a bill that would not lead to cuts in funding, but we must do more. We know that flat funding will prevent community health centers from meeting our constituents' needs. And while I'm hopeful our colleagues in the Senate will be able to raise the funding levels, the conversation must start here. Minister Johnson, can you speak to the importance of increasing funding for community health centers and how increases could benefit CHCs in states like New Hampshire?
Thank you so much for the question. That is very consistent with the way our budget is structured. We recognize that it is vitally important that we sustain where we are with health centers, but we are not meeting the needs of communities to their fullest. And we have the opportunity to do that here, in particular in a couple of key areas. We think it's important to make sure that we're expanding health centers into communities that need more sites. Convenience and access to healthcare is critical to delivery, as is making sure that we have expanded hours in health centers. Again, people who work shift work or have childcare issues or a host of things that can make it hard to see a doctor during normal business hours. If we can expand business hours in health centers, we can make it more convenient for people to get the care they need, and then they can go to a health center instead of going to an emergency room, which clearly costs more. And at the same time, we think it's vitally important to recognize the moment that we're in when it comes to the needs of families around mental health and substance use disorder. And time and time again, when I talk to primary care providers, they say visits that started out being about hypertension or other issues quickly become about a mental health issue. And so making sure that we can provide those services and provide that support in health centers is part of what we think is essential to meeting this moment for families' needs.
Great. You practically took the words out of my mouth because I visited a site in my district just recently, and they're embedding the mental health care in the healthcare facility and vice versa, embedding mental health care in the embedding healthcare into the mental health facility. So community health centers do play an essential role in combating addiction and mental health. And I'm the co-chair of the Bipartisan Mental Health and Substance Use Disorder Task Force, and I've seen firsthand the innovative ways that our health centers are helping meet people where they are to deliver the care that they need, as you mentioned, conveniently and in hours that fit people's real lives. Addiction and mental health challenges affect people of all ages, incomes, and backgrounds, which is why it's essential that community health centers remain accessible. Can you explain the importance of including mental and behavioral health funding for community health centers in future funding packages?
Thank you so much for the question. This is just vital to what primary care needs to be going forward. An individual doesn't experience a mental health condition separate from their physical health condition. They are one person, and we need to be able to treat them and when someone raises their hand and says they need help, we need to be able to meet that moment and help them. Today, health centers are only able to meet about 25% of the mental health needs of their patients and about 6% of the substance use disorder needs of their patients. We clearly need to do more to make sure that we are taking care of families and meeting their critical healthcare needs.
Great. Well, thank you so much. I appreciate all your efforts, and thank you to the committee for raising this important conversation about how we can improve access to both healthcare and mental health and substance use disorder and improve workforce. Thank you, and I yield back.